Welcome, everybody. I'm Dr. Fiona Tassoni, and I'm a doctor of Chinese medicine specializing in fertility. And today in this live stream, we're going to be talking about solutions to overcome your fertility challenges. I'll be focusing on hormonal imbalances, particularly PCOS and endometriosis, as well as male factor infertility and the impact of lifestyle factors on fertility. So if we just jump straight in to PCOS, otherwise known as polycystic ovary disease or syndrome, it's also called PCOS, but let's just call it PCOS for today. Now, this is a hormonal endocrine disorder that affects 1 in 10 women of childbearing age. And these women have not only a hormonal imbalance, but usually metabolism issues, and it affects their overall health. And it also affects their appearance. So we'll go into some of the symptoms that we see in PCOS so you get an understandable. But I think the biggest takeaway is that it's treatable. And I've had many patients have PCOS go on to have healthy, happy babies. So some of the symptoms of PCOS we'll see is oligomenorrhea. Now, this is basically irregular periods. We've got amenorrhea, which means no periods at all. That's usually the biggest symptom that we see, but there are, symptoms like multiple cysts on the ovaries, hirsutism, which is an excess of facial hair. It might be on the chin, it can be on the neck and throat area, it can be on the décolletage, even on the belly. So, it's just having this unwanted body hair, and it just gets in the way. We've also got pain during intercourse. Dyspareunia, it's its technical name. We've got acne, dark patches of the skin, plenty of mood disorders. Now, this is a big umbrella because you'll often find depression, anxiety, sleep apnea, and then if we look at the testing, what we're looking for, like if you're doing some lab testing, I'll often check your LH to FSH ratio, and the ratio is usually 1 to 1. So, it's roughly the same, around the same numbers. But when you've got that high LH reading, it's a possible indication of PCOS. 2 other symptoms we see is the insulin resistance and, bloating, weight gain, IBS. So all the symptoms that are related with insulin resistance. You could even have lipid profile elevation, prolonged PMS. So you can see that there's so many symptoms. And I think that's the key here is that it's a set of symptoms. And it's really working out what those are because it's different for every patient. And now the key symptom being the impaired ovulation, as I mentioned, which leads to the androgen excess. And that's an excess of the high male hormones. And that's what gives you that hair loss or the hirsutism and the acne. So there is a major complexity with PCOS. And in order to be diagnosed with it, we need 2 of the following. We need to see polycystic ovaries, which is on an ultrasound. We need to see irregular periods. Now, you can have 2 of these 3 symptoms and increased male hormones. Now, that can be found high testosterone levels, high DHEA, high growth hormone, found in a blood test. But the symptoms can be there, that hirsutism, that excessive body hair and feeling like, very masculine. There's 5 factors that are influencing PCOS. And they are excess testosterone, the insulin resistance, the gut health, liver function, and the emotional health. So, they're the red flags that we look for. You'll often see that raised luteinizing hormone, testosterone levels are elevated, and your insulin. All right. From a Western medicine perspective, metformin, this is an insulin lowering drug. It's often prescribed with Clomid or letrozole. This is the standard medical treatment for an ovulation in PCOS patients who want to conceive. In some cases, we've got surgical solutions. We've got ovarian drilling, and that's when we put a wedge in between the ovary to reduce the number of the arrested follicles. So this measure often just kickstarts the ovarian activity for a while. So today, for the purposes of today, I'm going to try and make it simple because it seems really complex. And I have 4 main types of PCOS that I see presenting in the clinic. Now, number 1, by far, this is the most common. This is the insulin resistance PCOS. This is where you've got high insulin, high leptin, and it just impedes that ovulation. And it stimulates the ovaries to produce more testosterone. So this patient is usually borderline diabetic, all right? They may have an abnormal glucose tolerance test. You'll probably see elevated insulin. You may have, and as I mentioned, the elevated LH. This patient is usually overweight, although they can be a normal weight. And they may have been struggling with lots of dieting or an eating disorder over the years. Now, what I suggest to these insulin-resistant types is that we work straight away on the gut and reduce all simple sugars and carbs. And it's not like we become carb-free, but it's those refined carbohydrates. And we want to focus on high-quality protein, non-starchy vegetables, and non-starchy carbohydrates, and load up on the fats. So I often find a little bit of gentle intermittent fasting is really good to improve their insulin sensitivity. There's a lot. I listened to a brilliant podcast just recently on fasting. Maybe I'll save that for another topic, but it's a great way to just kickstart your blood sugar, and even just a 5% reduction in weight can help them ovulate. So from a Chinese medicine perspective, remember, I'm a doctor of Chinese medicine. I do infuse East and West, but my specialty is Chinese medicine. So I will be strengthening the spleen. I'll be looking at gut healing protocols and insulin resistance strategies. It might be an insulin resistance protocol. And I will be looking at the kidneys from a Chinese medicine perspective. So, in Chinese medicine, we focus on a differential diagnosis. So every person has a differential diagnosis, and there's not one PCOS patient that's the same, even though they might be falling under this category. So if I look at some supplements that I might prescribe, my number one favorite supplement for PCOS, for hormones, for women, for fertility is magnesium. I love it. I love it for mood. I love it for sleep. I love it for blood sugar. It works on the conversion of T3 to T4. It does, like, magnesium just does so much. So if you don't have magnesium in your toolkit, we need to get that. So vitamin D, this is something else. I often find 85% of all my patients are deficient. So we need vitamin D up around 80 to 165 nanograms per milliliter. Now, I know that lab range feels excessive, and normally most lab ranges are around 48 to 80. Now, I need it at the top end, so 80 to 165. So we need it at the high end, especially for PCOS, especially for making babies. We need it for insulin resistance. We need it for lowering blood pressure. We need it for egg quality. We need it for reducing the risks of miscarriage, preeclampsia, and gestational diabetes. So vitamin D, another big famous one for this type of PCOS. Now, zinc's really important. Zinc and chromium, because they work on insulin resistance and testosterone. I'll often find there's folate deficiency because, if you're gut and you're insulin resistant, it depletes folate. So most of you are taking your PreConception multivitamins with 400 micrograms of activated folate, and we want to have folate-rich foods. Other supplements I might recommend, ALA, myo-inositol. There's things that I love for weight loss, because a lot of the time these patients are really upset about their belly fat and their weight gain. So L-carnitine, acetyl L-carnitine, NAC, I'll find berberine's my number one favorite. It lowers the blood sugar, but it works on belly fat. And it's great. You know, I'm going through menopause and it's super, super amazing for belly fat. So I love using berberine. It improves the cholesterol and the triglyceride levels, and it reduces the testosterone. Turmeric's another one. It helps with inflammation. CoQ10, I love that for ovulation and insulin resistance. N-acetylcysteine is great for insulin resistance. It's good for regulating periods. So they're the top supplements I would use for that category. Secondly, we're looking at post-pill. This is your over-the-counter, your prescription pill. And it's, when we're taking the pill, it suppresses ovulation. So most women, when you come off it, it's a temporary effect that ovulation is delayed, and usually it will resume fairly soon, but sometimes it doesn't. So ovulation suppression can persist with this type for months, sometimes years later. So the post-pill PCOS women tend to be thinner. They tend to be, more, how do I explain it from a Chinese medicine perspective? There's a lot of blood deficiency, a lot of yin deficiency, dryness, and liver qi stagnation. So some of the observable symptoms you'll see is really bad PMS. They tend to be thinner, they're highly anxious, they're not sleeping, and they've got a lot of irritable bowel and digestive complaints, especially like reflux. And this comes from long-term use of the pill. So from a Chinese medicine perspective, what we want to do is, nourish blood, tonify the yin, move the qi, and nourish the dryness. So, magnesium is great for that. I love, often these patients will have even constipation because with dryness, it's drying out the stool. So probiotics and magnesium are really important for this type. We want to eliminate the excess estrogen via the bowels. So if you're having constipation and you've just come off the pill, we need to get you on magnesium. And basically, I'll often prescribe magnesium citrate. What I love about magnesium citrate is that it's an osmotic laxative. So what that means is it works by drawing water into the intestines. So it softens the stool and it just makes it easier to pass. In addition, you could add some probiotics, and I love using food as medicine. So probiotics rich in food, sauerkraut, kimchi, kefir, utilize foods, and, we want diversity for the gut and the microbiome. So probiotics and prebiotics food. The third type is the inflammatory PCOS. This is caused by chronic inflammation, which can be from high levels of stress, environmental toxins. You can have intestinal permeability. You can also have inflammatory foods that this type tends to crave and eat, and that could be gluten, because that triggers a lot of inflammation in the intestines. So, and when this happens, it's really stimulating that adrenal androgen. So you may have higher levels of DHEA. So some of the symptoms of this inflammatory type, you'll see, impaired ovulation again, but, recurring infections. I think this is the key word. Recurring infections, headaches, joint pains, skin conditions. And your bloods may show elevated inflammatory biomarkers such as vitamin D deficiency. It might be abnormal blood count. It could be elevated CRP levels. It could even have elevated thyroid antibodies or gluten antibodies. So with this type, in Chinese medicine, we treat intestinal permeability with these formulas that we call goo formulas. These are formulas that help digestive complaints, chronic bloating, parasite infection, mood and cognition stuff going on. And we'll often do that as a fertility prep. So if I'm seeing any of those symptoms with impaired ovulation, I'll be definitely jumping on board with some of the goo formulas. And the supplements that are key here is zinc, glutamine, berberine, probiotics and magnesium, because they have that anti-inflammatory effect and they will normalize the adrenal hormones. And then lastly, we've got the adrenal PCOS. It's when you have those elevated adrenal androgens such as DHEAs. You'll have You can have elevated testosterone. You may have normal, and you may still be ovulating with this one, but adrenal PCOS accounts for about 10% of the PCOS diagnoses. When they're not fitting into a criteria, often it's this one. So, there's a lot of overlap with all these four. You'll see it's kind of a little bit confusing because, inflammation's a major driver in nearly all of them. But overall, I guess the takeaway is we want to find out what the underlying cause is. We want to treat according to that pattern. We will use a combination of Chinese herbs, acupuncture, and, the various supplements. It's not like we throw a whole lot of supplements. We utilize the key ones that you need for what your type is. But just know that PCOS is treatable. And it's, in most cases, it's about 3 to 6 months to regulate the cycle, and it's not a barrier to getting pregnant. Let's move on to endometriosis, otherwise known as endo. It's a chronic inflammatory disease. So these disorders are basically estrogen dependent. So it's what we call estrogen dominant. And this is when the estrogen levels are too high and it's creating those hormonal imbalances. I call this one's a real mystery. Like this one is super complex, and it's taken me many years to get my head around this one because it's so it's hidden. It sometimes takes 10 years to diagnose, and sometimes I'm struggling with this one because it's a whole body disease. It's chronic, it's progressive, and it affects 1 in 10 women, like PCOS. But basically, it's where the tissue of the lining, right, of the uterus gets implanted outside the womb and the pelvic cavity. And over time, it forms adhesions. It can compress the fallopian tubes. It can, really astringe the bowel. And, I've even seen it spread to the bladder. I've seen patients that even it goes up to the lungs and they get nosebleeds. So, especially when they're bleeding. So it's a fascinating disease, and it's tragic for so many women because so many women are suffering. Now, unfortunately, there are so many causes and so many theories, and there's not one diagnosis. So there's genetic links to it. There are environmental endocrine factors at play. As I mentioned, it's estrogen dominant, there's leaky gut, and there's also theories that endometriosis, well, I consider it autoimmune. So we need to really focus on the immune system and reducing inflammation. But there's also another common theory, and most of you that have endo probably are aware of this retrograde menstruation. It's when your endometrial cells, like normally when you're having your period, your blood flows out through the vagina during the menstrual cycle, but sometimes you can get the backflow through the fallopian tubes and out into the pelvis. So Chinese medicine, it's really interesting. We understand that backflow, and, we'll often see people, for example, we call this liver qi stagnation in Chinese medicine. They've got really bad PMS, really moody, irritable around just before the period, and like really strong cramps. And that really propels that backflow. And then, in Chinese medicine, we have kidney yang, which is it's warming, and if there is a depletion of that, like internal cold and, feeling, when people have internal kidney yang deficiency or internal cold, they tend to prefer to have warmth on their belly when they're getting their period. They might have cold hands and cold feet. They may not have that, but literally if you've got a depletion of kidney yang, basically it predisposes women to those endometrial implants. So it's not like because when we need the kidney yang to help it kind of be reabsorbed into the body. So these are 2 syndromes, with endometriosis that, we look at. So qi stagnation, blood stagnation, kidney yang deficiency. So those that have endo are 20% more likely to experience depression. Like it's a big thing. And then 50% of these patients have infertility issues. So if you suspect you've got it, then have a laparoscopy. It's the only way to diagnose it. And what that means is taking a biopsy, which means cutting out the suspicious tissue and getting a pathologist to actually look at it under a microscope so you can see if you actually do have it. Now, it can be silent. Some people don't even have symptoms. There are a couple of surgical treatment methods. So ablation is one thing, and it often, like, it's quite common to have ablation, but it can often leave remnants. So the recurrence rate with ablation is high. So excision, that's when we're literally cutting it out. And it tends to be the gold standard to remove it. I mean, the end of the road is having a hysterectomy. But sadly, I think that there's so many myths around it. And I think the takeaway is that pregnancy is not a cure. A hysterectomy is not a cure. Surgery is not a cure, and birth control is not a cure. See, a lot of my patients, they're young, they get told they've got endo, they get put on birth control. It's literally putting a Band-Aid over what the problem is. So some of the symptoms that we'll see is intense period pain. I mean, we're talking pain that's off the chart, like 100 out of 100, like not just 10 out of 10. It's to the point where these women cannot move. They may have PMT and period pain that is so debilitating they can't get out of bed. They feel so depressed. They will have, and it makes me teary, severe abdominal pain. They can have bleeding that's so heavy they're flooding. They can have irregular periods. So sometimes they can, do they have PCOS? You know, it's the diagnosis it's really difficult. They can have chronic fatigue, chronic bloating, gastrointestinal problems, lots of IBS, alternating diarrhea, constipation, pain during intercourse, bowel and bladder issues like urgency, and then frequent urination, or, you know, cystitis and recurrent, thrush infections. There can be ovarian cysts. There can be pain during ovulation. So you can see there's pain keep coming through here, this thread, pelvic pain, lower back pain, cramping, pelvic floor. Like, it can feel like your pelvic floor is just like this. And then because of that, all the cramping and pain, these people are usually got so much nausea, so much brain fog. And then this is where it flips, because I have had so many patients where there's absolutely no symptoms. They don't even know. They just can't get pregnant. And so this disease is probably, it's really quite sad. There's a high suicide rate with endo. So, you know, from a Chinese point of view, the beautiful thing is that Chinese medicine is very good at moving blood stagnation, resolving adhesions. It's really good working with Western medicine after you've had your excision, because it can reduce inflammation, improve blood flow, stop pain, balance hormones. So I actually love Chinese medicine working in conjunction with Western medicine with endo. I just think that the more doctors that, when they understand that Chinese medicine can really fix, the problems once it's been excised, and then we can get women and their hormones and their inflammatory markers down, and usually they can conceive. So I had a patient just recently, and this is a really interesting story. She'd had multiple rounds, I think about 5 to 10 rounds of IVF. She had, her endometriosis was so bad that she had her fallopian tubes removed. She had a bowel resection. She had cysts on the ovaries, and she came to me, and I was the last attempt before she gave up. Now, she'd had excision, so she'd had it mostly removed, and then we got to work. We followed this protocol, and I'm going to share this with you. What did we do? We made sure that she had an anti-inflammatory diet. We made sure that she was off all cold, all raw. Okay. She was this person that thought that fruit and she did a lot of fruit detoxes, which is the thermal nature of fruit is cold. So she did a lot of raw fruit, raw smoothies with coconut milk, which is very greasy and cold, and it's very hard to digest. So with endo, we eliminate cold and raw and cold food. So that includes like a lot of carrot and hummus, all these things that you think you're doing that's just healthy. And we swapped it for bone broth and warm foods and steamed vegetables, soups, stews. So basically, we had to train her to eat like a baby. We want to have everything closer to your body temperature because then it's not overly taxing your digestion. And then that's nurturing and warming. It helps with blood flow. It's harmonizing the blood. It's nourishing the blood and chi, and it's gently moving it. And we also worked on, triggers. What were the triggers? The key triggers for her is getting off gluten, getting off sugar, getting off dairy and alcohol and caffeine and a lot of red meat. She had a lot of red meat. So it triggers inflammation. And I'm not saying you can't have red meat, but say more yes to lean organic and poultry and hormone-free where possible. We also avoided things that were phytoestrogenic. So that's your soy compounds. So we got her off those things, and we added in all the nourishing things, all the things that are rich in diindolylmethane, which is all your cruciferous vegetables. This is your brassica family, cauliflower, broccoli. What else? Cabbage, bok choy, Brussels sprouts, kale. Like all those things, they support healthy healthy estrogen metabolism, and they get rid of excess estrogen from the body. So sometimes if I've done a Dutch test and the patient has those high levels of estrogen, I will get them on a DIM supplement. But otherwise, it's, diindolylmethane is in all your cruciferous vegetables. So just eat the vegetables. I prefer you to eat the food and let food be thy medicine because food is far superior than any supplement. We also got her to add in sulfur-rich vegetables, more glutathione foods, so asparagus, avocados, spinach, carrots, because glutathione is the master antioxidant. It's the detoxifier. It neutralizes the harmful estrogen quinones. We get fiber-rich foods because estrogen binds to fiber, and fiber is an escort. It gets rid of it. So fiber-rich fruit, nuts and seeds, legumes and beans and whole grains such as quinoa and rice and oats. And then things like your ABCs, apples, beets, carrots. But we want beets and carrots to be cooked, not raw, because they contain the fibers that are great at detoxifying estrogen. You can what else? I'm thinking liver-friendly foods. So bitter greens, things that are bitter greens, radishes, lemon juice, apple cider vinegar, sour foods like kimchi and your pickled vegetables. I mentioned those before. By following these guidelines, you will decrease inflammation and pain. You regulate your hormones. You'll reduce masses and improve blood circulation, and you'll have a fabulous effect on your endorphin levels. So it's similar to PCOS in terms of, magnesium is my number one. I love it. We want B complex because, often there's stress, and B6 helps with melatonin production. But all the other, there's other supplements that I haven't mentioned with PCOS, but are great for endo. Resveratrol. We've got DIM serapeptase to break down those adhesions, essential fatty acids, because the fish oils they're very good, and they can be found in all different walnuts and flax seeds and chia seeds, hemp seeds, edamame, seaweed and algae. But we've got probiotics. In Chinese medicine, I have a couple of formulas that I might start people with. We have classical formulas, and one of them, Tao He Chen Qi Tang and Gui Zhi Fu Li Wan. Now, the Tao He Chen Qi Tang, it's got peach kernels. Peach kernels are one of those most amazing herbal supplements we use in our formulas, and it breaks things up. It breaks up blood stasis and masses in the lower abdomen. So Gui Zhi Fu Li Wan, it's got cinnamon. We all love cinnamon. It's great for dispelling blood stasis. It's very warming. It's great for moving masses in the abdomen. So these are two formulas. And obviously, remember, everyone has a different differential diagnosis. Part of managing the pain is getting to the root cause of what it is. And, does it need to be excised? Can we just use blood movers and unblock the vessels and get the blood moving? So I find, working with Western medicine in conjunction with Chinese medicine, so you've got your team around you. And I call it the God team. Have your team and get diagnosed, do a laparoscopy, get it excised if it's stage 4, get it out. And then we just want to address the pain and balance your hormones and improve the blood flow. So you can apply heat packs, you can apply castor oil packs, you can practice lower abdominal breathing, because we need a combination with endometriosis of stillness and rest. We need this, I don't know if you've heard of polyvagal theory, but we need to activate the parasympathetic nervous system. And so practicing that lower diaphragmatic breathing, which is why I always coach all of my patients to do lower diaphragmatic breathing. I teach a lot of breathing exercises because I'm really wanting to do, I want to turn on that vagus nerve and activate it so that you're getting your parasympathetic nervous system activated into, rest, nest, digest, and conceive. We want to try things like meditation, but there are so many therapies you can utilize. So, kinesiology, there's so many, Reiki, there's lots of different things to invigorate blood circulation and healing and energetic healing. All right, I'm going to move on to male factor now. So what is male factor infertility? It's caused by multiple factors, such as abnormal sperm production, low sperm count, and it could be blockage of the delivery of sperm. All right. So, and then you've got, issues with testosterone. There can be hormone imbalances, so which is impairing their fertility. So it's safe to say that hormonal imbalances are related to male factor. Now, of all the fertility cases, 50% are due to male factor. So we've seen a decline in sperm. I've done another live stream recently. I've actually covered a lot of this in that live stream, but we've seen a 60% decline since the 1970s, and it's declining steadily at 1% per year. And so basically we need to look at what we can do for men, and the first thing I will always do is get your semen analysis. I always start with that first because it's the gold standard for determining whether there is male factor contributing to infertility. Now, the semen analysis we're testing 4 main reference values. Volume needs to be greater than 1 ml. Concentration, this is your sperm count. It needs to be greater than 15 million per milliliter. Now, this is a great gauge of your hubby's or your partner's overall health. It's influenced by lifestyle factors such as alcohol, stress, obesity, medication, and fevers. All right, so it's good to even examine your partner's testicles to see if they've got enlarged veins in the testicles. We call that a varicocele. The third parameter is your motility. We want it greater than 40%. We want sperm with no tails. We want to make sure that we've got moving sperm. And again, it's also affected by lifestyle factors. Motility is affected by lifestyle factors. We'll discuss them. And then the final parameter is your morphology. We want it greater than 4%. Ideally we want it 8 to 12 or above. I'd love to see 30% like I used to see 20 years ago, but I'm not seeing that much anymore. Now, morphology is the analysis of the sperm shape. It's the percentage of sperm that are considered normal. So these parameters are based on the WHO 2010 parameters. Now, before that, they used to be a lot higher, so they have decreased. Now, the morphology and the motility, I've talked about these lifestyle factors, and they are usually low sperm morphology and motility are associated with the testicles overheating. Like, we have so much inflammation. So we want to look at the lifestyle factors with guys because we can fix sperm. It regenerates. This is the beauty of it. It regenerates every 74 to 90 days. So what you do from today, and we do it for 90 days, you won't see the benefit for 90 days. So guys, we want to get you, want to tidy up the diet. Again, an anti-inflammatory diet. We want to have, foods rich in antioxidants like fruits and vegetables and healthy carbs, quinoa, millet, rice, lots of veggies, good fats, your omega-3s, fatty fish, nuts, walnuts, Brazil nuts, seeds like, pumpkin seeds, which is great for sperm. And I recommend a multivitamin with folate, 400 micrograms of activated folate, and drinking about 2 liters of water a day for men. We've got to remember 96 to 98% of semen is water. So with the lifestyle factors for men, exercise, so movement. Now, guys, sometimes guys have active jobs and they think that's movement, but it's not. We need active movement aside from work. So it could be just walking, especially if the testicles and they're overheating. You can do some testicular temperature readings and see that it's, measure the body temperature, measure the testicular temperature, make sure it's 4 degrees difference. We want the testicles cooler. We need the testicles cool for optimal sperm production. So we often need to tidy up men and do an anti-inflammatory diet. We need to look at their stress management. Guys don't tend to tell you when they're stressed. They tend to wear it on the inside and until they explode. So if you're finding your partner's exploding, you can damn well guess that they're pretty stressed on the inside. And so we want to look at techniques they could do. Now, what's wrong with taking your partner to acupuncture? It's the best thing for reducing stress. Put them on the table, put some needles in, they're relaxed. They're like, yeah, God has gone to having a big schluffing. So find that thing that they like to do if they don't want to have any. Guys are funny about having therapy, but it could be get them a massage, have some reflexology, do what they, find the thing that they like to do. Introduce them to some apps like Headspace or Happify. I love these because they could just listen to some things on mindfulness and, cognitive reframing or cognitive behavioral therapy. The main takeaway with guys is the tidy up, avoiding or reducing tobacco or vaping. Now, they might be smoking and they love it. So you might want to introduce Alan Carr's The Easy Way to Stop Smoking. Say, darling, here's this book, Alan Carr's The Easy Way to Stop Smoking. Light up a cigarette and read the book. And it really addresses the psychology of smoking. Caffeine and energy drinks. You've also seen, I don't know if you've heard in the news, but Red Bull is now being sued for people getting very sick from the energy drinks. They're not healthy. And we want to get people off the energy drinks and caffeine because it messes with the hormonal balance. We need to get the cortisol down, the inflammation down, and the caffeine, the energy drinks, just send it back up. So we've got to fix the problems, and they're kind of non-negotiables for me, taking the alcohol out. So yeah, then it's like lastly with lifestyle factors for male factor is looking at your environmental toxins. Pesticides, we've got that on all your crops. So we want to, try and do organic where you possibly can. We've got phthalates. Plastics are everywhere. They're in our wraps. They're in our, plastic bottles, plastic straws. So opt for a glass water bottle, or copper, or, change things up, help them out. And even if you don't have to tell them this is for your sperm, men don't want to know. Just tidy it up in the kitchen and do it subliminally. So they go, oh, I've got a lot here. Darling, I've bought you a glass bottle to sit on your desk. We're both going to start implementing more water into our diet. Here's your beautiful bottle. Load it up with some lemon juice. It's just going to work on those detoxification pathways, hydrate them, and it's working on the sperm. So look at the BPAs in your tinned and aluminium cans. Look at BPA free. Look at the Teflon coating in your frying pans. We've then also got things like halides. Now, these are toxins that they pretty much invade everything. So we've got bromines found in bread and flame retardants. So these is in your, your furniture. And we've got fluoride and chloride and perchlorate in our drinking water. So can you get a water filter? Can you, even if it's a jug and it just eliminates, it filters the water, or buy filtered water, or get a water filtration system in your home. Now, halides, what they do is they block iodine receptors in our body, and they lead to cancers and thyroid disease and obesity and learning disabilities and mental, autism in children. So I'm seeing a connection between iodine. So, we might need to do some testing. Sometimes I'll do patch testing with my patients. And if they are doing a patch test and it's fading within an hour or half an hour, we'll keep doing patch testing through the pregnancy all the way up, until they actually give birth. Right. So, and I get it on the guys because we have a depletion of iodine in the food chain. The Japanese have a high incidence of iodine in their food source. They eat a lot of seaweeds. They have a lot of fatty fish. So it's in those things. It's also in eggs. It's just your sea veggies. And, their incidence of cancer and obesity, and autism is the lowest in the world. So there's something there. All right, so I have covered male factor. Some strategies in addition, just quickly, is not sitting on heated seats in the car. This is a big trend. Seating on heated floors, laptops on the lap. It's because it's heating up the sperm, and it's cooking the sperm. Hot tubs. Change it up for an infrared sauna. So get out of the hot tubs. Bike riding, it's really, long bike rides are really not great. And the lycra pants. So we want to get out of the bikes and the lycra pants. So shorter bike rides, mobiles out of the pockets, laptops off the lap. I mentioned that. And, some of the symptoms that you can guarantee if there's sperm issues with men, they might be sweating at night. So, you'll feel like, oh, he's so hot, I'm so cold. So that's a big sign. We need to fix things. We need to clean up the diet, get him on some castor oil packs, improve the water assimilation. He could have lower back pain. Or, then there can be cold symptoms. The penis is cold to touch. She might have erectile issues. He could have gut issues like, loose stools, bloating. He could be on medications. Now, I'll often find people that are on statins or asthma or blood pressure medications. They really impact the sperm. You've got to get on the right medications. Tell your doctors that you're trying to conceive. Medications have a big impact on sperm, so you need to just make sure that they are fertility friendly. Other mood problems is they could be really anxious, depressed, and chronic fatigue. The main takeaway is the sperm is so important. Just remember, it's 50% of the equation. Don't give the guys a free pass. They often do. So as I mentioned, you have PreConception multi. It's hard to get guys to take a lot of vitamins, but a PreConception multi vitamin with 400 micrograms of your activated folate, CoQ10, L-carnitine, vitamin D, selenium. I love this for sperm function. So, even get them to have 3 to 6 Brazil nuts. Make a trail mix of, Brazil nuts, walnuts, pumpkin seeds, goji berries. It's a lovely trail mix. Don't tell them it's for the sperm. Don't tell them anything. Just say, I've made this lovely little trail mix for you in your hamper. And, they can take it to work and feel special. Men like to feel special, like you're taking care of them. We also have, some strategies in Chinese medicine. Wu Zi Yang Zong Wan. It's a pill. It's a 5-seed pill formula that works on the sperm. It's known as the 5 ancestors tea pills. That's another translation. We'll often use that with their pattern. So their pattern of diagnosis when I'm diagnosing them. So they'll get their constitutional formula, plus they'll get that. And I love that formula because it's got 5 Chinese herbs that work on infertility, low sperm count, erectile dysfunction, morphology, motility, DNA fragmentation, and it just overall improves the sperm quality and testosterone levels. But there are things guys can do. You know, Western medicine might suggest Clomid. They might do HCG injections. There are other strategies of doing growth hormone. There's a plethora of things to do. There's so much. And remember, it's a case-by-case thing. You don't just want to throw everything at men. Find what it is. But if they're, you know, you might want to start with some tribulus. If they're got low motility, it improves concentration. But it's a lovely yang tonic, and it's a chi tonic, and it works on the Sertoli cells, so it nourishes and matures the sperm. So these are all just a few strategies I wanted to share with you. Those 3 key things. Just know that with sperm, it takes 90 days, so 3 months. Sadly, with the endo and the PCOS, it takes longer to diagnose. But remember, once you get your diagnosis, around 3 to 6 months to get back into balance. And it's not the end. It's not like you have to have a hysterectomy. It's not like it's over. It's just the beginning. So just know that acupuncture is something that you can work with all of these 3 things. And you can use so many amazing strategies. I always talk about castor oil packs for hormonal balance, but they're brilliant. We've got femoral massages. We've got abdominal gua sha. There's so much you can do. But I just really wanted to say thank you. Thank you all for joining me. Thank you for your time. And I will see you again next week for the next live stream. And if anyone wanted to contact me, you can contact me on Instagram or Facebook. I'm Dr. Fiona Tassoni on Instagram. And if you just type in my name, Dr. Fiona Tassoni on Facebook. Thank you.
Okay. In the